I'm Dr. Montalvo, one of the surgeons of Mexico Bariatric. Um, I have I think like 10 years doing bariatric surgery. Um, right now, uh, I think like a couple of weeks now, I am a fellow of the American College of Surgeons. So I think that's a plus to our U.S. patients, so they can have security that they're going to have a good procedure. Um, the the kind of surgeries that I make is the the gastric sleeve, the mini gastric bypass, and then the R&Y. Uh, the gastric sleeve, I think, is one of the most common procedures. Um, in the gastric sleeve, we remove like the 85% of the stomach using from 1 to 5 mini incisions. And this procedure is a restricted procedure. It means that you're going to eat less and it's not malabsorptive. So with less portions, you're going to feel full more fast. What to expect with the gastric sleeve is a high amount of excess weight loss, removed portion of the stomach, of ghrelin. Ghrelin is the hunger hormone. So that is in the fundus of the stomach, and we're going to remove it so you're not going to have more hungry. Hold less food and decrease the food intake, and is a minimally invasive laparoscopic surgery. The gastric sleeve will take like duration of 1 hour. All right, all the process from when you get into OR, doing the surgery, anesthesia, and then go back to recovery. It will take like 1 hour, 1 hour and a half. But the procedure of surgery, it will take like 30 minutes, 45 minutes. Okay. The pros, it can be easily revised if needed. It means that in the future, if you think you need a revision surgery, it will be more easily to do if you had an RY or another kind of surgery. The comparable weight loss with bypass is like the same. It's very low. The 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 percent that of weight loss with gastric sleeve and with the R&Y. And other pros is that short recovery time. If you need to go back soon to your activities or go back to work in a few days, you can be able. And the cons can worsen if you have a pre-existing acid reflux or GERD, because the pressure inside of the stomach go go going to be more. So if you suffer from severe reflux or GERD, uh, this is not the choice for you. It will be a bypass, all right? And the other thing is a non-reversible surgery. The average of 1 year exercise weight loss is like the 70 to 75%. Okay. Um, Next, please. Okay. Talking about R&Y, the gastric bypass surgery forms a new stomach pouch while the remaining stomach stays in the place. Approximately, we need to make a pouch and it will be like the 10%, 15% of your stomach. All right. So the small intestines are reroute to the bypass food digestion, which creates malabsorption and reduce calorie intake. So with this, the RNY or the mini bypass are malabsorptive procedures. It means that you're not going to absorb all the nutrients. What to expect with the RNY is more significant extent weight loss than sleep. The new stomach form to reduce the hunger and limit stomach capacity resolves like in the 95% type 2 diabetes. And this is the best choice for patients who suffer from reflux or GERD. The pros is the RNY is known as the gold standards of bariatrics. The RNY was the first kind of surgery for weight loss. But in all these years, there come a lot of other modifications. One of that is the mini bypass, and it have the same weight loss with the bypass or the RNY. And there is a high success rate. The cons is the change of vomit, dumping syndrome, or high risk of ulcers. This is because in the gastric tract we make some changes. Okay, so that's why it's a high surgery. Okay, or a bigger surgery. And the duration of the RNY is perhaps like 2 hours, okay? Because we need to make more connections, 2 connections. One with the small bowel and the gastric pouch, and the other one is with the bile duct between the two in the same small bowel, okay? Here, the patient needs to stay 3 nights at the hospital, and the recovery will be 2 to 4 weeks. All right. Next. The mini gastric bypass is a modification of the RNY, or it's called the one anastomosis or one connection in this surgery. Okay. This connection of one anastomosis or one connection is we did it in the RNY. Okay, the only thing here is that the RNY we need to make another connection between the same small bowel, but it's for the bile duct. All right. The mini gastric bypass divides the upper portion of the stomach. We need to make a pouch like this, like the 10%, 15% of the stomach. And then we exclude like 2 meters of the small bowel. And we make that connection between the small bowel and the stomach, all right? The small pouch. The intestine is looped to connect with the new stomach to decrease the amount of calories that you absorb. That's why this kind of surgery is malabsorptive. And it means that that all the calories that you eat, not all of them you're going to absorb, all right? The expectations is to reduce the feeling of hunger through the altered gut, early satiety and feeling full after small portions, reduce calories and nutrients absorbed, and like the other procedures, is a metabolic surgery, so it will be resolved if you suffer from diabetes, hypertension, cholesterol, like in the 90 or 95%. It means that if you take some pills for control, maybe in the 90%, 95%, you're not going to need more meds. The pros is a single anastomosis. It means one connection to the gastric pouch and the intestine. Is safe, effective, and shorter procedure than standard RNY because it's one connection. In the RNY, we need to make 2 connections, and this can have more high risk. One of the most effective surgeries to reverse failed gastric sleeve or lap band. And the cons is change of vomit or dumping syndrome, like in the Roux-en-Y, the higher risk of ulcers and change of bile reflux. The duration of the mini bypass have approximately uh, 1 hour and a half or 2 hours. It depends of each surgeon, and you need to stay at hospital 3 nights. Okay, and the recovery is the same, 2 to 4 weeks. It is important to know that the risk of complications in all of these surgeries is less than 1%. All right, is less of 1%, and the most common of complication that you can have, because it exists, is less than 1%, but exists. All right, so is the you can have a bleeding, all right, or one of the incisions, infection of one of the incisions, like any surgery. All right, so no, nothing really to be worried about. We know that we are doing here at our hospital. MBC use accredited facilities. Our teams use standard infection protocols, screening of patients and staff, like the CT scan for COVID-19. We have antibacterial stations available within our facility, and fully compliant protective and preventive measures. Do not currently allow visitors due to COVID-19 measures. All right. So only the patients can be here at the hospital.